I'm Brittany Calderwood.
I'm Rachel Barker.
I'm Mariana Russi.
And this is our video for the shoulder special test for shoulder injuries.
I'm gonna perform the anterior and posterior load and shift test. This test is used to assess glenohumeral instability. What I'm gonna have to do is I'm gonna have the patient sit on the table. I'm gonna stabilize the shoulder by putting my hand on the clavicle, and then I'm gonna push forward and back. And if we have a movement more than 25%, the test is positive and we probably have a glenohumeral instability.
I will be performing the apprehension test. This is to test for any instability to the glenohumeral joint, specifically in the anterior direction. What I'll do is I'll have my patient seated. They will have their elbow flexed at 90 degrees and then abducted 90 degrees as well. What we'll do is we're going to stabilize their arm and then their humerus as we slowly go into external rotation, which will bring that glenohumeral joint anteriorly. We are looking for any apprehension as we're doing this, and any signs of pain or discomfort from the patient by just looking at their face, or any signs that they give us. If there is any of this apprehension, that would be a positive test for the apprehension test and could indicate injury to the glenohumeral instability in the anterior direction.
I will be performing the posterior glenohumeral apprehension test. What I'm going to have my patient do is lay in a supine position. I'm going to bring her shoulder and elbow into 90 degrees of flexion. So we're going through this. And then I will stabilize her wrist and her elbow, and I will apply an axial load. What I'm looking for is apprehension from the patient. So if she fights me on the axial compression and resists that force, that's a good sign for a positive test. If she shows any sign of fear of dislocation or any other signs of apprehension, it's a good indication of a posterior glenohumeral apprehension test or instability in the glenohumeral joint.
Now I'm gonna perform the sulcus test. This test is used to assess glenohumeral instability, specifically an inferior instability. I'm gonna have the patient sit on the table. I'm gonna stabilize by the traps, and then I'm gonna push the humerus down. And if we see a devote in this area of the glenohumeral joint, we probably have an inferior instability of the glenohumeral joint.
I will be performing the shear test. This is to test to see if there is an injury to the acromioclavicular joint, most likely a sprain. And what a positive test would indicate would be pain or laxity in this region. So I'll have my patient seated. What I'm going to do is put my right hand on the back at the spine of her scapula, and my other hand will be just right by or on the clavicle. And we're going to just compress. And as we're compressing, if there is that pain or laxity, compared bilaterally as well, then this would indicate a positive test, which could lead to a positive diagnosis of an acromioclavicular sprain in this region for the shear test.
I will be performing the sternoclavicular joint integrity test. I'm going to have my patient sitting in front of me, and I'm going to find the clavicle. And once I found that, I'm going to find more of the center of the clavicle, and I'm going to be applying a downward force on top of the clavicle. I want to be careful that I don't push backwards, just in case there's a lot of sensitive things right there. We don't want to cause any more problems. So as I'm pushing down on the clavicle, I'm looking for joint laxity or pain. So I'm going to test bilaterally, and I'm going to test and see if there's any more laxity in the injured arm compared to the opposite arm. I would also make sure that my patient's okay and ask if there's any pain. If there is pain or a little bit more joint laxity in the sternoclavicular joint, we would probably see that there is a positive test for the sternoclavicular joint integrity test. I'll be performing the drop arm test. We are looking for an injury in the rotator cuff. While performing this test, we are looking for pain or uncontrolled movement in the shoulder. What I'm going to have my patient do is bring her arm straight above her head with her palm facing outward, and then I will ask her to lower her arm slowly, and I will look for ability to control that movement, and I will ask my patient if she has any pain. If we see an inability to control that movement or pain throughout that, it's a good indicator that we have an injury to the rotator cuff and a positive test for the drop arm test.
I will be performing the empty can test. This is to test to see if there's an injury to the supraspinatus muscle, and a positive test would equal weakness while performing the test. So I'll have my patient in the seated position. What she's going to do is, as I'm standing in front of her, she will hold her arms out 45 degrees, she's straight out, and then if her wrists aren't already, they will be internally rotated, just like she's emptying cans. I will place both my hands on her wrists and hold them there as she attempts to move her arms upward in this direction. If there is any weakness on either side of or either arm, this could indicate an injury to the supraspinatus muscle. If the injury may seem severe at first, we can go closer to her shoulders. If that's too easy, we'll move down to her wrists. And like I said before, any weakness shown would be a positive test to the empty can test and can indicate injury to the supraspinatus muscle.
I will be performing the infraspinatus strength test. I'm looking for pain or weakness while we go throughout this test. What I'm going to have my patient do is sit with her elbow at 90 degrees. I'm going to apply a force and stabilize her elbow, and then I'm going to have her externally rotate her arm as I apply a force against her. So as she's applying that force, I'm looking for weakness or pain or lack of ability to respond against that load. And then I'm going to test bilaterally. So I'm going to do the same thing, stabilize the elbow and have her push out against. And if we see that there's pain in the injured shoulder, or there's a weakness compared bilaterally, it's a good indicator that there's an injury to the infraspinatus and a positive sign for the infraspinatus strength test.
Now I'm going to perform the speed test. This test is used to assess a pathology in the biceps brachii, specifically in the long head of the biceps brachii. I'm going to have my patient sit on the table. I'm going to ask if you can put your arm with a 90 degree in the shoulder. What I'm going to do is push down, and I'm going to ask my patient if you can resist my hand and push forward, up. If we are going to have a weakness in the biceps brachii, we have a probably pathology in this muscle.
I'll be performing the pectoralis major contractor test. This is to test to see if there's a tight pectoralis major muscle with my patient. A positive test would indicate that their elbows do not touch the table. So this test, pretty simply done, my patient will be in the supinated position, and I will ask her to put both of her hands behind her head and to just lay her elbows down and to relax them. If without actively trying to place them down, if they do not reach the table, this would indicate a positive test for a tight pectoralis major muscle. If they did touch the table, then that would be a negative test. And this is just to test to see if those muscles are tight in this region. I will be performing the Hawkins-Kennedy test. This is to test to see if there is any impingement syndrome to the shoulder. And a positive test would indicate any pain in this region. So I'll have my patients in the seated position, and with the suspected injured arm, she will have her elbow flexed 90 degrees, and then also internally rotated 90 degrees as well. So what I will do is I'm going to have my stabilizing hand at her elbow, and then my other stabilizing hand will be at her wrist, and with my left hand I will be performing a force that is going downward. And as we do this, if there's any pain in her shoulder region, this would indicate a possible positive test for the Hawkins-Kennedy test, which could lead to shoulder impingement syndrome.
I will be performing the Crank's test. We are looking for a tear or an injury to the labrum of the shoulder. What I'm going to do is have my patient lay in a supine position, and I'm going to bring her shoulder into about 100 degrees or 150 to 160 degrees of flexion with the elbow at 90 degrees. I'm looking for pain and popping or clicking. So what I'm going to do is I'm going to apply an axial load to the humerus, and I'm going to move the shoulder through a range of motion, through that rotation. And if my patient feels that pain or popping or clicking, it's a good indication that we have a tear or an injury to the labrum, and it is a positive sign for the Craig's test.
Now I'm going to perform the compression rotation test. This test is used to assess a pathology in the labrum, like a labrum tear. I'm going to have the patient lay down supine, having the arm relaxed, the shoulder in an abduction position in 90 degrees, and the elbow in 90 degrees as well. What I'm going to do is put a compression force in the humerus, and at the same time internally rotate and externally rotate. And if we have pain or clicking, catching or rocking feelings, we have a positive test and we probably have a pathology in the labrum.